So my name is Samantha Madden and I am the lead primary care liaison and screening liaison nurse for adults with a learning disability in Cornwall. So our team are made up of 5 nurses. So we've got 3 nurses that work within the primary care liaison team. And our main role is to focus around learning disability annual health checks. It's to support with the validation of GP learning disability registers. It's also to support with reasonable adjustments, to support patients to access primary health care, and support with best interest and mental capacity assessments. The screening liaison team are made up of 2 nurses, again a county-wide service, and they help support with the uptake of the 5 national screening programmes, which are breast, retinal screening, bowel screening, cervical screening, and the aortic aneurysm screening. So yeah, again, similar to our team and their approach, in the fact that they're trying to enable patients to have equal access to healthcare and screening services, and they support with training, as do our team as well, but also they link in with the national screening hubs. So we know that people with a learning disability generally experience poorer physical and mental health than the general population. We know that poor quality healthcare leads to avoidable deaths in our client group, and preventable deaths. We talk about things like reasonable adjustments and really raising that profile. We know that reasonable adjustments are key in identifying and supporting patients to access healthcare in a timely manner, and reasonable adjustments are part of the Equality Act. A big part of our role is to support GP surgeries to validate their learning disability registers. And that's really important because it's moving away from having a learning disability diagnosis, and it's mainly based now on need and vulnerabilities rather than purely a learning disability diagnosis. So it really helps capture some of the most vulnerable people in our society who, without being identified, may fall through the net or may not be open to relevant services. So annual health checks, they are key in identifying unmet health needs in our client group. They also lead to earlier diagnosis, which leads to better treatment outcomes. Within Cornwall this year, we achieved 80% of learning disability annual health checks, which means 80% of people with a learning disability in Cornwall have received a learning disability annual health check. The team have worked really hard to do this. However, we are still striving to achieve better statistics and better quality annual health checks.